You know, if you really want to get a handle on where cancer treatment is headed, you've got to look back. And lucky for us, a huge new analysis of the last decade in oncology research has done just that. It lays out this super clear story of where we've been, what's happening right now, and the amazing stuff that's just around the corner. All right, let's get into it.
Okay, so our whole story kicks off with this one number, 57,603. I mean, just think about that. That's how many research abstracts from the American Society of Clinical Oncology, that's ASCO, were crunched to paint this picture. So we're not talking about a few cherry-picked studies here. This is basically a treasure map of an entire decade of work in the war on cancer.
So, the big question is, what does this mountain of data actually tell us? Well, it turns out a whole lot. When you sift through it all, you start to see these really clear patterns emerge. You can see exactly how one massive breakthrough just kicked the door open for all the incredible tools we have today, and for the even crazier stuff that's on its way.
All right, let's rewind the clock a bit. We're going to start our story about a decade back with a type of drug that didn't just move the needle, it completely changed the game. Seriously, this was a total rewrite of the rulebook for how we even think about fighting cancer.
You can't even begin to talk about modern cancer therapy without mentioning PD-1 and PD-L1 checkpoint inhibitors. What do? Well, put simply, they take the brakes off your body's own immune system. They basically give it the green light to go out, recognize cancer cells, and attack them. And that single idea, unleashing our own bodies to do the fighting, well, that became the bedrock for pretty much everything that came next.
But what's really wild is how these drugs evolved. I mean, they didn't just show up and stay in one little box. No way. They quickly became the go-to, the standard of care, for a ton of different cancers. Then, they started moving up into earlier treatment settings, to stop the cancer from ever coming back. A perfect example is nivolumab for head and neck cancer. It was the first new approach in 20 years to actually improve survival. And maybe the biggest thing, they proved that long-term survival wasn't just a dream anymore for cancers that used to be an almost certain death sentence.
So that checkpoint inhibitor revolution totally set the stage for where we are today. And now oncologists have this incredible new toolkit to work with. Building right on top of that immunotherapy foundation, 3 key innovations have popped up that are just completely changing how we find, track, and treat cancer as we speak.
First up in the kit, circulating tumor DNA, or ctDNA. And this is so cool. Just think of it as a liquid biopsy. So instead of having to do a painful, invasive tissue biopsy, doctors can now find tiny little fragments of a tumor's DNA just floating around in the blood, all from a simple blood draw. I mean, that's absolutely revolutionary. Okay, so what can we actually do with this? Oh, so much. We can spot a cancer occurrence months, sometimes even years, before a traditional scan could ever pick it up. We can see in real time if a treatment is actually working or not. It helps us put the right patients into the right clinical trials. Take the SERENA-6 trial. They used ctDNA to guide treatment changes for breast cancer patients, and it nearly doubled the time they lived without their disease getting worse. It's the perfect example of how we're shifting from just reacting to cancer to actually getting ahead of it.
All right, next up in the toolkit is something you've heard a ton about, artificial intelligence. And yeah, for years, AI in medicine felt a little like science fiction, right? Just a lot of hype. But what this data shows loud and clear is that we're past the hype. It's really happening. AI is being put to work right now across the entire landscape of cancer research.
And it's making a real-world difference in a few key areas. First up, diagnosis. We have AI models now that can actually outperform human experts at certain tasks, like analyzing tissue samples. Second, it's making research so much more efficient by playing matchmaker, finding the perfect clinical trial for each individual patient. And third, it's getting predictive. AI is starting to help us forecast who's going to respond best to which treatment, which just takes personalization to a whole new level.
And the third major tool in our new kit is the antibody-drug conjugate, or ADC for short. Now, this is a seriously clever piece of engineering. It's a hybrid therapy that takes the laser-like precision of a targeted antibody and combines it with the raw, cancer-killing power of a chemo drug.
Honestly, the absolute best way to picture an ADC is to think of it like a guided missile for cancer cells. The antibody, that's the guidance system. It's programmed to hunt for a very specific target on a cancer cell, and nothing else. And the chemo drug? That's the warhead, the toxic payload. So this missile seeks out its target, locks on, delivers that payload right inside the cancer cell, and boom, destroys it, while leaving all the healthy cells around it pretty much untouched. And the world of ADCs is just exploding right now. For the longest time, we really only had a couple of targets to aim for. But now, we're seeing this huge wave of new ones. You've got trials looking at c-Met in lung cancer, SEZ6 in neuroendocrine tumors, Nectin-4 in all sorts of different cancers, FR-alpha in ovarian cancer. I mean, every single new target is like opening up a brand new front in this fight.
Okay, so all of this, the checkpoint inhibitors, the ctDNA, the AI, the ADCs, it's all building towards the next frontier. If you think ADCs are cutting edge, then you need to hear about cell and gene therapies. These are the things that felt like total moonshots just a few years ago, and they are quickly, and I mean really quickly, becoming a clinical reality.
Yeah, this quote from a recent ASCO meeting really just says it all. For so long, these super complex therapies, where you literally take a patient's own immune cells out, re-engineer them in a lab to hunt cancer, and put them back in, were pretty much limited to blood cancers like leukemia. Well, that barrier, it's officially being shattered.
And look, this isn't just some lab experiment anymore. This is real. We have the first ever FDA approvals for solid tumors. For metastatic melanoma, there's a therapy called lifileucel. And for a really tough, rare cancer, synovial sarcoma, we now have afami-cel and lete-cel. These are therapies that literally reprogram a patient's own immune cells to see and kill their cancer. These approvals are a massive, pivotal moment in oncology.
But with this kind of incredible power comes some pretty huge challenges. We have to balance the promise, and we are talking about life-changing results, even the potential for one-and-done cures, with some very real-world problems. The cost is astronomical. The side effects can be severe and sometimes delayed. And just the logistics of manufacturing these personalized treatments for every patient, it's unbelievably complex.
Okay, so after that whirlwind tour through a decade of cancer research, what's the bottom line? What does this all mean when the rubber meets the road? How do we connect all this amazing science to the day-to-day realities of healthcare?
Well, first, let's talk money. The economic reality is just staggering. One report projects that by 2029, global spending on cancer drugs will hit $441 billion. And that number isn't just big for the sake of being big. It reflects just how complex, how expensive to develop, but also how incredibly effective these new medicines are.
And if you want to see where that money's going, look no further than the research pipeline. Sure, we're still improving on the older stuff, but these new, novel therapies, we're talking ADCs, cell therapies, and so on, they now make up more than a third of all new cancer trials. The whole center of gravity in oncology is shifting towards these smarter, more complex medicines.
So if you had to boil this entire decade down to just a few key takeaways, it would be these three big shifts. First, we went from broad to precise. Treatment is now hyper-personalized. Second, we moved from chemo to biologics. The pipeline is now jam-packed with these complex targeted drugs. And third, we're shifting from being reactive to being predictive, using tools like ctDNA and AI to get out in front of the disease.
And all of that leaves us with one last and maybe most important question. The science is moving forward at a breathtaking pace. I mean, we're developing treatments that honestly felt like pure science fiction just a few years ago. But as these therapies get more powerful, more complex, and a whole lot more expensive, you realize the biggest challenge of the next decade might not be a scientific one, it might be a social one. How do we make sure that these incredible breakthroughs get to every single patient who needs them?